You never notice the good work that's done. You
Right.
only
That's
notice, I
right.
guess, the bad work or something that's not natural. And I thought that's interesting because there
Mm-hmm.
probably are a lot of women going around with
Mm-hmm.
enhanced lips or whatever they're doing. And I did look so natural, I didn't even notice. Do you think that's true?
Absolutely. When work is done well, you should look better.
Mhm.
And I hate to say it because some people, I have them in my office and I say, I don't want to use the word prettier, but that's really what people will look like when they look
Fresher. I
better.
think maybe.
Fresher is probably a more politically correct word.
Yeah.
But yes, you do look better when it's done right. And
Yeah.
it should be pretty undetectable. People should not really figure out what it is.
All right. Well, it's a real pleasure to have Dr. Carolyn Chang on the show today. Welcome.
Thank you. Thank you for having me.
We had a really great pre podcast talk, and I wanted to get to know you better and see what you do. And I think that right away we just started talking about Kris Jenner's facelift because I'm like,
That's
that just
right. Everybody,
it just
everybody's
like
talking
came
about Kris
out.
Jenner.
And I think right when you were talking, I was like, everywhere I was seeing it, all my social media. I was just, she kept popping up. I couldn't believe it. And it just was mind blowing what a plastic surgery can do. So everyone's really talking about it. And as one of the most respected plastic surgeons in the country, and from your professional perspective, what do you think she had done and why does it look so darn good?
I think she had probably a lower face and neck lift. And I think it looks so darn good because she did it right. So
Mhm.
she had a facelift before. I think she had even mentioned that probably 10 or 15 years ago.
Yeah.
And so that slowed the aging process way down over the next couple of decades. And so then when she had the touch up done, the secondary, we call it a secondary facelift, then it really preserved her youthfulness because she has not ever really allowed herself to get old. She looks a little older sometimes, but she never looks as old as she really should if she hadn't had done any work.
Anything.
And
Yeah.
so she did it right. She is doing things all along the way. So she's not saving up all of her aging and doing one thing at the end. So
Oh,
it's smoothing the transition.
I did my first podcast interview with, I think it was Dr. Amir Karam.
Mm-hmm.
Does facelifts. And she was a request from my audience. And I went into that podcast like, I will never do a facelift. I
Mm-hmm.
remember my mom doing one and she was suffering. She's like, God, if I knew how painful it was, I'd never do it. And I remember thinking to my mom, what? I don't see the difference. I just didn't see. It's so not worth it. So I went in there already thinking,
Mm-hmm.
after that conversation, I was like, how much are your facelifts? Because I was blown away by what can be done. And it certainly was not the facelifts of my mother's generation. And so now I'm thinking, when you're telling me, geez, you don't save up. Like I'm thinking, oh, I'll just save up so that when I'm 70, then I'll maybe do one. So I'll save up now. But what you're telling me now is maybe not to do that. Is there a disadvantage to people who say, look, not that I don't take care of my skin, but I'm just not going to do the facelift. I'll do it when I'm 70, as opposed to somebody who says, no, I'll do it at 50, I'll do it at 68, and then who knows what you're going to do when you're 80s. What's the better approach?
I think, and I think most plastic surgeons would definitely say there's a disadvantage to waiting to do your first one if it's something you're going to do. And the reason is because when you start earlier, when you're in the right mindset, there's no reason to delay it because what we do with the procedures today, they're so sophisticated and so precise that we can actually put your tissues that have aged back anatomically exactly where they started. And so, even though you have outward signs of aging, like the skin quality or the amount of facial fat, that might change with time. But the contour, we can actually get you to a much earlier decade. And your face shape and structure internally is going to be exactly the way it was when you were, let's say, 30 or 40. And so, you can't stop aging. So, then what happens is you're now starting your aging all over again from a much earlier set point. So let's say you do the lift at 50, you put your tissues back to where they were when you were 30 or 40. Now from 50 to 60, you're aging a whole heck of a lot slower. And so you're never really letting yourself get really far gone. And so then when you do your secondary one, perhaps 10, 15, 20 years later, then you're starting already from a winning position. And then you perk it back up anatomically to where it started again. And so that whole transition is just really smooth over the decades. So
Mhm.
if you're waiting all of that time, then you're losing all of those years when you could be looking a lot more youthful than you currently look. So I'm not saying that everybody should do this. I'm saying that when you have something to fix and when you are mentally ready and you perceive that you need it and want it, then you don't wait, you do it. And it may not be for everyone, but if it's for you, then you just do it when you're ready. Don't wait.
Oh my goodness. Okay. So let's go back to Kris Jenner because I remember you telling me something that was super interesting. What should we expect her facelift to look like in the next, I don't know, 3, 4, 6, 12 months? Will it be any different than what we're seeing on social media?
Well, back when we talked, it's when it first came out. And so I don't know how far post-op she was. My guess, it probably wasn't more than a couple of months. That's my guess, because she's not someone who can stay out of the media's eye for too long. We would be missing her, I think.
Yeah.
So when you're in that more immediate post-operative period, sometime in the first three months or so, you're going to have a little bit more volume overall in your face, which on most people does look better because you get some of that natural plumpness that you may have lost over the years that the facelift itself can't necessarily bring back. And so maybe that's why she was looking especially radiant then. I don't know what she looks like now, several months later, but usually you'll see the final result of what you're going to get around 6 months. So all of that last swelling's come down, everything's settled nicely, the scars are looking really good, and you should still have a really nice contour. You might lose just a tiny bit of that plumpness. And so that may be where she is, but I suspect she still looks pretty darn good.
Mm. So I've been addicted to these YouTube videos that figured out my algorithm that I'm watching all of these other doctors comment on it. But it just because
Mm-hmm.
it blew my mind. I didn't think
Mm-hmm.
that you could look like you're 35 when you're nearly 70. I didn't think
Mm-hmm.
it was just physically possible. So I was just fascinated. So all these things are
Mm-hmm.
popping up, and there's some doctors that would mention something like what you're saying, or they would say, "Oh, she's probably on weight loss peptides." You can see maybe that helps as well. And some other people comment on her haircuts, this little bob, this
Mm-hmm.
cute little
Mm-hmm.
bob with these little bangs, and just little girl like, and
Mm-hmm.
maybe all of that influences the look as well. What do you think?
Not all of us have the luxuries that she has and the availability, time, finances, and desire, right? We're busy. These things may not be the most important things in our lives. But for her, she's a public figure and she has to look good. That's part of her job. So she has that advantage. And then she also has access to everything. So I think that it's a combination of everything. I think the foundation of her looking more youthful now is definitely the surgery. There's not anything you can do non-invasively or holistically that's going to reproduce that structurally. But she does have the advantage of perfect skincare, good genetics, right? She's got a great haircut. She looks good. So she may be on the GLP-1s, but whatever it is, it's working for her. So I think it's the sum total of everything with the basis of keeping up with herself surgically in the beginning. So we all can achieve some version of that. It's just how much you're willing to do.
Well, it seems like she's setting a different standard or a new standard. You, like you said, she's a public figure, so we're all
Mm-hmm.
looking at her, and I mean, there's other people too. But what do you think? It feels like the 70s now is the new 40s. It just because she's completely disrupting this whole aesthetic world of aesthetics. So what do you think that aging will look like for menopausal women in the future? Will there be a divide between those who can access the surgery and all of the things that she may have and those who cannot or choose not to do it?
I think that there will be some divide in terms of maintenance types of things. But the bottom line is certain people do have genetics. And so genetics can always be on your side. I'm always blown away when I go to Asia. People do not look like their age. They're decades younger, and that's just nature doing its work. So the bottom line is if you have good genetics, you have a good start and you have a real head start. And then I think that over time, I know about all the treatments and I can access most things. I have friends, if you know what I mean. But I don't choose to do a lot of things because it's not in my lifestyle. And so what you do is you customize your aging and you don't get down on yourself. That's not really all this comparison and all this aspiration, I think, with social media is really detrimental because the bottom line is women are beautiful. Every country, every way, and you do the best you can, and you do what you feel is right for you. But you can be maximalist, and you can look like Kris if you want to. It's
Mm.
just something that has to be your goal, and it has to be achievable financially.
Exactly. You need the time and the willingness as well and the money
Right.
because not everybody's
Right.
willing to cut themselves open. I mean, I just had
Exactly.
2 hip
Not for
surgeries
everyone.
and I was trying to avoid that as much as I
Right.
can. I don't want to
Right.
cut things out.
Right.
But
Hmm.
that's the question. I've had podcasts about this before in terms of beauty standards, and you try not to be judgmental. You
Hmm.
decide what's best for you and let the person be, whether they want to do whatever they want to do or they don't want to do whatever they want to do. And I think there's just a place for everybody will find their place. And I'm a big fan of Paulina Poroskova, who
Oh yeah.
that ex-formal
Hmm.
supermodel, and
Hmm.
she's just looking brilliant. And she doesn't seem to do anything maybe than a facial, and but she's got great genetics.
That's, yeah, I would say pretty much top of the line.
She's got good genetics, but I feel like she's probably somebody who does take good care of herself. Just physically, she probably eats well. I don't follow her that closely, but it seems like she's got all the other lifestyle factors, and that will take you far too, because you could probably do all of these surgeries and not take good care of yourself and smoke and still get in the sun and eat garbage and not, then you
Right.
maybe will not get
Right.
quite the same results as Kris Jenner. It does something. That's why it's always nice to have that holistic approach. And yeah, so I think we'll find out what's right for us. I kind of lean somewhere in the middle. It's
Hmm.
something about genetics that you mentioned because I lived in Hong Kong and I remember I told you when I first met you,
Hmm.
yes, I mean they are genetically gifted, but I have also seen some older looking Asians who do
Hmm.
not take care of their skin and
Yep.
they're not wearing the umbrella and the gloves and
Hmm.
protecting their
Hmm.
skin like
That's
everybody
right.
else. And they've got sun damage and the
Hmm.
wrinkles. Genetics will only take you so far. So I think that,
I do have an interesting story about that. And this actually blew me away. I operate on people all the time, but I don't necessarily know about their families. And so, in that whole lifestyle topic that we're talking about, I had a woman that I was doing some suture removals for after a facelift, and she was beautiful in her 60s, perfect skin, perfect lift. She looked so youthful. Contour was probably around 45. And as she was talking, I said, "Well, your skin looks really good. What are you doing?" And she started talking. She said, "I have an identical twin, but she doesn't look so good because she had some health issues. So she has some diabetes that this one didn't have. She had a totally different lifestyle. She ate a little bit more, wasn't living in California, wasn't pressured to feel like she needed to be fit. So as time went on, her health deteriorated much more than this patient of mine. And she said, "You wouldn't believe how different we look." And these were identical twins. And then she did show me a picture, and it is remarkable. So lifestyle is something that definitely is a contributing factor. And you're seeing it in Asia as well. And that's what you're commenting on. So I will say to people in the audience that whatever you, if it's important to you, whatever you can do on your own is going to benefit you. And with the advent also of these GLPs helping postmenopausal women, I do think that you can even feel better as well for the right patient with their doctor's advice. But I do think that those are some things that are changing the face of menopause.
well, I'm glad you mentioned the twins because in
Hmm.
longevity and gerontology, we always look at twin studies because
Yes.
it's proved that lifestyle
Hmm.
and diet have a huge impact because you've got exactly the same genes. And I'm sure people who are listening probably know of sisters or brothers. They're
Hmm.
not twins, but yet they're pretty close in genetics, and one takes care of themselves, one doesn't, and they can
Hmm.
look and feel and have completely different health outcomes.
Right.
One can die much earlier than the other, and that's why we look at these studies to prove that. So I'm
Hmm.
glad you mentioned that because that's an
Yeah.
important thing that we should all keep in mind. And again, beauty is so different in
Hmm.
Asia, for example, than it is in the West. And I've
Hmm.
experienced that. So we have to just talk about, I guess we're talking about a Western beauty. Because I remember in
Hmm.
Asia, people were always talking about the V face and they really
Hmm.
wanted this V-like
Hmm.
chin. And I was like, what's that? And I never thought about that. Or they want
Hmm.
white porcelain skin. And
Hmm.
I was happy to have a tan. And it's just completely different beauty standards. But I have a feeling that there's this shift towards imperfect beauty. Like maybe people are talking about skipping the veneers now because that was like perfect looking teeth and maybe keeping
Hmm.
their natural looking twists. I mean, not a not teeth that need to be really fixed for many other reasons, but there seemed to be a shift, yeah, towards this imperfect beauty. And I don't know if there's a similar trend happening in terms of natural results in aesthetics.
I've been in practice for about 20 years and you see things shift. And I have a certain demographic as well. So the people I operate on tend to want to be a little bit more under the radar and they come to me for that. But I would say, on the one hand, there is a shift towards naturalness, which is wonderful. But I think it's naturalness on steroids. So if you look at the social media, which unfortunately we all are succumbed to, you'll see pictures of, let's say, Lindsay Lohan. And they say, oh my God, look how beautiful and natural she looks. But there's nothing natural about her face. It just looks good.
Mhm.
So I think that the change is probably when you do, it's a little bit more maximalist in the approach to looking natural, if that makes any sense to you. So everything is so magnified in terms of what we see that in order to achieve Lindsay Lohan's look, you had to operate on every single part of her face. But it harmonized in such a way that it looked right for her, even though you know in your mind it's not natural. It's like looking at what do you call it when you face two in your face, right? You're amplifying what you look like naturally. So it still looks like you, it just looks like a whole lot better you, but then your mind and your eye is so used to seeing those enhanced images that you think those are natural. So
Mm.
I like to call it naturally unnatural. That's the look that we have right now. It's true. When I first started practice, breast augmentation, for instance,
Mhm.
I would joke that I would do these women who were double A's, and when I was done with them, they would still look like they needed a breast augmentation. But they'd be so happy, so natural, so droopy still. But that's what they wanted. Now, those same women want to look a little bit more done because that to them, as a result of social media, looks natural.
Yeah.
That's what I think's going on. It's
It's
fascinating.
interesting. Yeah, this episode, I'll have to link this episode in the show notes because it was between me and medical aesthetic journalist and a biohacker longevity friend. And so we were discussing what's going to happen. And one of my concerns was like at the time, especially, I wasn't sure if all my friends around me are getting big lips and
Mm-hmm.
fillers and having this other look. Am I going to go one day, gosh, I'm not beautiful because I don't look like them because
Right.
that's the new beauty standard or something
Mm-hmm.
like that. I get a little worried because I was like, oh, I don't like that. But maybe one day, I mean, I can't ever say never. But what
Right.
we came to the conclusion is it was Alice Hart Davis, and she said when you see something that's not that's done, it's a little bit off, and your
Mm-hmm.
brain registers this and understands that maybe you don't know exactly what it is, but you know it's not natural, something's not right. And she said you never notice the good work that's done. You
Right.
only notice, I guess, the bad work or
Mm-hmm.
something that's not natural. And I thought that's interesting because there
Mm-hmm.
probably are a lot of women going around with
Mm-hmm.
enhanced lips or whatever they're doing. And it looks so natural. I didn't even notice. Do you think that's true?
Absolutely. When work is done well, you should look better.
Mhm.
And I hate to say it because some people I have them in my office and I say, I don't want to use the word prettier, but that's really what people will look like when they look
Fresher. I
better.
think maybe.
Fresher is probably a more politically correct word.
Yeah.
but yes, you do look better when it's done right. Absolutely.
Yeah.
And it should be pretty undetectable. People should not really figure out what it is.
Yeah, exactly. I mean, maybe if you know that person, yeah. But yeah, I remember probably about 3, 4 years ago when I went to LA after, I mean, I live in Europe or at the time was maybe in Hong Kong. And I was really surprised. Like, I just seemed like everybody around me had some kind of augmentation and it wasn't something I was surrounded by. And that's why I had this
Mm-hmm.
question like, oh, wow, is that going to be the new thing? But it
Mm-hmm.
seems as though that's why that question of, are we heading more towards imperfect beauty? I know that explants are kind of a big thing now for women
Yeah,
of my age or your age.
absolutely. Mm-hmm.
And all that work that you've
Absolutely.
done, I guess people are taking it out now. And I'm happy. It's like, oh, that's the new beauty standard. That's great because I've
Mm-hmm.
always been flat chested. And, but that's just another thing I'm wondering. Is that a trend or is this just people who are in my health space worried about toxicity or something like that?
I do think that there is a definite trend towards smaller breasts in the United States, which is a new thing. I mean, it's never going to be 100% that, because the bottom line is people come for breast augmentation to look bigger. But I do think that there is a growing awareness and understanding that's a possibility. I think a lot of people didn't understand that breast augmentation doesn't mean you're going to be a double D necessarily. You could get a small one and be a B. And
Yeah.
so that now, I always did in my practice, but it wasn't the standard. And now I think it's becoming a standard request, which I think is wonderful.
Yeah. It gives the people what they want, I guess, right? And
Yeah,
that's the,
exactly.
there's
But
always,
what they want is an ideal for them and not necessarily for the from the male gaze or the beauty standard that you see all along.
so for the women in peri and postmenopause who are coming to see you, what's the number one concern you think that she comes to you with?
I will tell you, it's interesting. It doesn't matter if they're coming to me for face or body or breast. The number one thing they say is, I have aged more in the last 3 years than I had in the previous 10, universally. And it might be that they're focused on their body or their face. They're most often focused on their face, because by the time you get into your mid 50s, you've probably made peace with your body. Most people have, but not everyone. And so that's really what I hear over and over and over again. The number one concern is, all of a sudden I look middle aged and
So
I
they're
don't
not
feel the way I
saying,
look.
they're not pointing out, oh, it's my droopy eyes or my droopy jowls or my
It's
wrinkly
the
skin.
whole thing.
Oh, okay. They're like, just rehaul.
Yeah. Everyone feels all of a sudden, about when they hit in the early 50s, it really starts. 53 is sort of the sweet spot. And I never understood why until I read something that the average age in menopause in the United States is 53. When that estrogen goes, it just plummets
Yeah.
fast. Over like a year or two, you look totally different.
Yeah, and you feel different. That's exactly what I
Mm-hmm.
say. Our hormones
Yeah,
are so life-giving. Like it's such a
absolutely.
powerful anti-ager, anti-inflammatory, anti-everything. And when we lose it, it's not only, yeah, sometimes you notice it quickly in our skin, but our joints. I
Yes.
had osteoarthritis and I was able to
Mm-hmm.
hack it for years. Like, it's just
Mm-hmm.
bouncing right back. And then the hacks just weren't working anymore as soon as I hit menopause. So it's kind of scary. And that's why
Mm-hmm.
we focus so much on this podcast on hormones and trying to understand and where we are. It's interesting that you see it too. And that's what you're saying
Mm-hmm.
when the women are just losing their estrogen, they come to you. So, how do you think then that menopause affects the skin and face structurally beyond just the wrinkles?
Well, definitely everything is drier. So that's one thing that really accentuates the aging look of your face. Because when your skin is plump, no matter what age it is, the skin looks more youthful. So that is one major thing. The other thing is, you do discernibly lose a lot of elasticity. And so that's also, when the estrogen goes, you lose the plumpness and the elasticity at a higher rate than you did previous to that. And so you're seeing a lot of that rapid aging over those 2 years, 2 or 3 years afterwards. And that's what people are responding to. And they could have it in their breasts, they could have it in their body. Hormonally, also, you're gaining weight. So then you have droopiness on top of weight gain. So it's looking heavy in the lower part of your face all at once. It's not good. That's a cluster of everything.
What is the start? I think it's we lose about I think it was 30% of our collagen just in the menopause transition itself
I
between
would believe
5 to 7 years.
I
Yeah,
would
like
totally believe it.
what's this
Yeah.
slow, I mean, loss of
Yeah.
1% every
Yeah.
year after the age of
Mm-hmm.
30 or 40 or something like that. But then once we get
Yes.
into menopause, it's like,
Yes.
whoa, accelerated collagen loss.
Yes. Definitely. And then the other thing that I'm seeing is, I would say probably 30% of my patients are on these GLP-1s, and that's accentuating it as well, because the tissue quality is also not as good. I think there's some level of nutrient imbalances that happen no matter how well we try to eat, and then the rapid weight loss on top of it. So it's just this huge cluster of, I mean, no wonder facelifts are such a topic right now. It's a confluence of all kinds of factors going on: increased awareness of menopause, increased weight loss, increased accessibility, awareness, all of that.
Yeah, I'm wondering too if your patients who are on the GLP-1s, when we say GLP-1s, we're talking about these weight loss peptides like Ozempic or Wegovy. And so you have this rapid weight loss, but I'm wondering if some of them are, at least the word on the street says that most people are not getting their protein in. Like you said, your
Yeah.
appetite is suppressed. So you're not eating very
Yeah.
much in general,
Mm-hmm.
but on
Right.
top of it, if you have to eat your protein, it's hard enough to eat protein when you not when you have a normal
Exactly.
appetite.
Mm-hmm.
But maybe as well, protein is our hair, skin, nails, and so
Mm-hmm.
maybe that has something to do with
Mm-hmm.
just accelerating that look as well.
Yeah, I definitely agree with you there.
Yeah. So, okay. Well, there's things we can do. Like I wish people knew. And there's also one thing you didn't mention, and I think it is every time I've interviewed somebody in aesthetics, when we ask, oh, what can we do to slow down the aging process of our skin? Most of them would say take care of it from the sun. Wear your sunscreen or
Mm-hmm.
wear a hat or gloves,
Yep.
umbrella, whatever it is. We like the sun. It's good for us, but not so good for our skin. So, do
Right.
you see in your patients the ones, because you're in California too, on top of it?
Yes. Mm-hmm.
California
That's right.
tend to be out in the sun a lot. So, do you see those who've taken care of wear sunscreen or have the shade versus those who don't?
I do. It's a generational thing, though. My older women really didn't grow up that way. They grew up with baby oil in the sun with aluminum foil reflectors.
That was
So
me.
they, and
Yeah.
then if they play golf now, it's a disaster. So I see a generational shift, though, for sure. My ones in the 30s and 40s always are very careful about sunscreens. Maintenance and prevention is huge. If you start it early, unfortunately, if you just try and start it later, it's never a bad thing, but you can't catch up. So that's why I do think that one of the really helpful things that you can do that's short of surgery would be a little bit of laser resurfacing at all different levels. If you can get rid of some of the sun damage and then give yourself a head start when you're using that sunscreen, it
Mm.
always can rejuvenate you in a nice way.
Laser resurfacing, is there, because
Mm-hmm.
there's like fractional lasers and all these other types of, is there a
Yeah.
specific laser that's better for the skin in terms of removing
Well,
sun damage?
I am not a laser expert because I
Mm.
operate so much. I can't really run a whole med spa. I'm one of the few surgeons that doesn't do that. But in general, the classes of lasers are ablative and non-ablative, and then there's all kinds of different wavelengths that target different things in the skin. But the basic principle is small resurfacing is going to give you small results. In order to really resurface the skin properly, you need to get to a level in the dermis that is adequate to shed all of that epidermal pigmentation and wrinkles and all that stuff. And so that is a recovery. It
Mm.
definitely is. I think it's quite an intimidating recovery in some cases, but I think mentally it's easier for people to think about doing something surface rather than cutting. But it can be very powerful.
Mm.
And so I would say that the depth of the laser is really the determining factor of how well it works in the end.
Mm. So we got to go aggressive.
Yeah, if you really want a result, you got to do the real thing.
Yeah.
That's my opinion.
Oh gosh. Okay, Dr. Chang. Women, let's talk about women in midlife. They're always asking me how to look better without going under the knife. I know that's your specialty, but as one of the most respected plastic surgeons in the country, what are the most effective non-invasive treatments that really work?
Well, we talked about the lasers. I think lasers do work if you choose them correctly. They
Mhm.
can go a long way.
And
As far as those
that's for
for
skin
some resurfacing,
resurfacing,
pigment,
the
yeah,
pigmentation.
pigment,
Yeah, not.
texture, fine wrinkling, pores, all of those textural things.
Mm,
And those are things we can't do with surgery anyway. So it's always good to combine that if you are doing surgery. So that's probably one of the most powerful things. The other things that I think that are powerful are Botox. I mean, it's a tried and true thing. It can definitely smooth the result, especially in the upper part here. It can definitely make you look a little bit softer and a little less aged if it's done really subtly. What I don't like is those sort of Cruella looks, the
yeah.
sharp, and so it needs to be very subtle. And I do like the idea of the baby Botox, which is just a little bit to just smooth things out. The other place that's nice is down in here in the neck. So if you have a lot of skin, it's not going to help you. But if you had just have a little bit of banding, sometimes just softening those can help as well. And then there are really subtle sort of lip flip techniques that I do find are nice. Now, granted, if you are well into your aging process, it may not be so good, but as an overall thing, it's not going to erase the contour problems, but it can definitely soften, let's say, the lines in here and make you look a little less stern.
Mm,
So the tried and true Botox, I think, is always going to be a useful weapon.
yeah. So surgery can't iron out those wrinkles. That's the thing. You don't catch like stretch it enough so that you don't need Botox. Is that correct?
So the way I talk to patients about it is that when I do an operation, I fix structure. So I fix contour because what we're doing is we're lifting, we're tightening, we're changing the contour of your face. But I can't change the actual skin quality. The side effect of tightening is the skin looks better because you've tightened it. So it's like taking a piece of wrinkly linen and you tighten it. So the only thing that's going to change that wrinkle in the linen permanently is going to be something that treats the quality of skin, which is what all these non-invasive things are designed to do. So the two work tandem together in the perfect situation.
What are your thoughts about Profilo? That's a hyaluronic acid, if I am correct. And that some people inject that. It's not a Botox. It doesn't give you these results like that. But then they say it just takes, I don't know, 6 weeks or something like that before you actually see. It sounds interesting, but is it effective at all? As you see any?
So there's a lot of, and I don't know if this is one of them because I'm not familiar with this exactly, but there's a whole move towards technology of introducing things that you put in the skin and they enhance your own natural growth factors and stem cells and things like that to actually produce more of the collagen or the hyaluronic acid or the elasticity, elastin. And so it's something that stimulates. And so I think that's probably what this is that you're talking about. I do think that is the future of aesthetics, especially non-invasive aesthetics. There are even not synthetic, but there are processed fat for people who don't have fat that you can inject to revolumize. These are just really nascent fields right now. But I think that's really what's exciting, because the one thing that is missing in the anti-aging process when it comes to surgery is the revolumizing, the perfection of that. We're getting much better at it with fat grafting and things like that, but it's not perfect yet. We would love to have your own skin regenerate its volume. That I think is exciting.
That's interesting. I'm going to watch this space. There's so much out there like that we have now that our
So
mothers
much.
didn't have. And so when you do a surgery, and I'd like to talk a little bit more about the types of surgery that you do, but people are putting in fat transfers to bring that volume. Does that stay or does that just fat go away over time?
So once the fat takes, the fat stays because it's a living structure. So the problem is you cannot predict how much it's going to take. So if I put 10 fat cells in area X, maybe only 5 lives, or maybe 7 lives, or maybe 2 lives. So this is the part that's a little less predictable. However, whatever lives should live. Now, unfortunately, it would also grow. So you have to maintain the weight. You have a lot of fat transfer.
So
So yes, fat is very powerful. I think it's very subtle. It's beautiful when done correctly. And I think it's much more elegant than a traditional filler.
yeah, exactly. So that's why I'm going to talk about the difference between fats and fillers. But so what if you put fat transfers into two cheeks and it sticks to one and not the other? And what does one have bigger cheek than the other?
Well, you do unless you have the other one redone. So you can always add fat to it, right? But there usually is not that much asymmetry in
Okay.
someone because first of all, we're not putting that much in. So we're not creating Quasimodo, So it's a
I
lot more
see they
subtle.
pop up on my Instagram. I'm like, what? There are these crazy people. I don't know what
Yeah,
they're doing, but
yeah.
it is
So
quasi.
the fat transfer, generally speaking, is pretty subtle. And so the
Okay.
differences that you see in my practice, in my hands anyway, are very minor, but you can always touch things up. You can add a little bit more. It's
Oh,
always better
okay.
to add more. It's hard to take away. So,
Oh, interesting. So then
mhm,
let's talk about fillers because
mhm,
nowadays everybody's saying that fillers actually don't dissolve. They just migrate or something like
mhm.
that. So how does that affect you and your work when you're trying to do?
One trend that I've actually quite happily embraced is the discussion of dissolving fillers before you have surgery. And I do think that it is actually very helpful for the surgeon and for the patient to achieve a more natural result. A lot of times people have fillers, they come to me and they don't even know they have it going on. I had a woman the other day who was a nurse actually, and she had a little bluish tint right under here.
Under her
And she
eye?
said she had fillers and she said that it was never quite the same. And she had someone actually dissolve it, but she still had it there. It's called the Tyndall effect.
A
And I
what
was going to do a
effect?
face Tyndall, Tindl, and it has to do with the light reflection.
Mhm.
But I was going to do a facelift on her. And I said, you know what? You're going to get a better result if you have someone ultrasound that area and dissolve it further. So even the people that are going in to dissolve, sometimes they're not getting it all. And so then once we got rid of it all, that blueness went away, her natural shape came back, and we were able to reconstruct her in the most beautiful, perfect, natural way. So I do think that coming back down to something that is your own self before surgery, and also before doing additional procedures, I think is really helpful because you are more precise with what you're doing
Mm.
in all cases. Even if you're adding more filler, you're more precise.
Yeah. And so is the trend going away from fillers now? Is
I
that
think so. And
filler?
I'm very happy about that.
Yeah, I'm
I
good.
think there's
I
still a role,
missed it.
definitely.
I was thinking about doing it until all this came out, and I'm like, oh,
I
okay, I guess
think
it won't.
so. My big beef with filler, and it's because I do surgery, is that you're always, no, unless you're someone who's 30 and 40 where your face hasn't changed that much in terms of its anatomic structure, hasn't fallen as much, you're always augmenting something that's artificially augmented. If you imagine someone in their 60s, right, and their cheeks have come down, but you're filling here. So now you have fat here and here, and you've got that pan fat look. And so it just doesn't work because it's supposed to be an enhancement. There's no way you can put enough filler in to push your face up.
Yeah.
So that's where the paradigm got distorted. I think it's still powerful when you have just small things to fix, and
Mm.
it's a very useful modality. But I think those days of trying to use just a filler to create a facelift are gone. Thank goodness.
Yes. Okay. Fantastic. I just saved myself a whole lot of money. Sagging jowls. We haven't talked about that. That's a really
Mm-hmm.
big frustration in midlife and a marker of aging, which I mean, I don't want to be ageist, but now you can tell.
Mm-hmm.
But what's the most effective treatment or surgery for that?
There's really nothing but a lower facelift that's going to adequately fix those jowls. So for those that don't know exactly what a jowl is and are too embarrassed to ask because it's
Looks
such a
like this.
ubiquitous term,
If you go
it's
to
these little
YouTube.
pouches that occur as we get older around the face. And the reason they happen is because the underlying tissues fall down and they pivot around this point. So the only way is to unpivot it, which means that you're coming up and back. And so I think the most beautiful vector for a lift is not straight up or straight back. It's a circle. It's a J, like this, because that's how it fell. So if you put it back as a J up, you're going to look like yourself, and it's going to fix these little pouches that happen when it rotated down and around.
Everybody go to the YouTube because then you'll see exactly what we're talking about because it's super, yeah, interesting. And then when you show it and you have this J effect. So let's talk
Mm-hmm.
about then the difference between the traditional facelifts
Mm-hmm.
and the deep plane facelift that everyone's
Yes.
buzzing about. And is that what you do?
So
Deep plane, I'm not sure.
So I use the deep plane absolutely. So let's talk. That is a really important topic because there's an evolution to everything that we do in any surgery field, and there's an evolution to facelifting. So I had the privilege of training with one of the founding fathers of the modern day facelifts. So he and a group of people were responsible for delineating the anatomy underneath the deep plane, understanding how to use it safely without injuring all of the nerves. That was the number one thing, and understanding how to manipulate it to get a good result, to get a reconstruction of your aging process. And so the principles are all the same. There is only one plane. The deep plane is the same thing as the SMAS plane. And that's where people are getting very confused. So there's a whole group of surgeons that do a SMAS, and there's a whole group of surgeons that do a deep plane. And the reason for that differentiation is the evolution. So the deep plane facelift is one specific technique that uses the SMAS in a way that releases the SMAS from all of its attachments and allows for a very free movement.
Hmm.
So it's not a SMAS lift. It is using the SMAS. And
What's a
then
SMAS?
so the SMAS is the layer of tissue underneath the skin. And it is an actual named structure. It is in anatomy books. So the real name for the deep plane is an acronym, the superficial musculoaponeurotic system. And that's a SMAS. The deep plane lift was a name that was used to describe a very specific technique using the SMAS.
Ah, okay.
And it was mostly in the ENT literature. So there are otolaryngologists that are facial plastic surgeons, and there are plastic surgeons that are cosmetic surgeons.
Oh,
And
wait.
so it's
Difference. One is for aesthetics and one is for like if you're in a car accident.
no, that so you can go to facial. There are two sort of fellowship ways that you can get to facial surgery. One is through if you train as an otolaryngologist and then you branch out into facial aesthetics. So that society is called the Society of Facial Plastic Surgeons. They're called I don't know what they're called because I'm not one of them. But there is a society just for facial aesthetics, grown up through the ENT side, otolaryngology side. Then there's the traditional plastic surgeons that branch out into cosmetic surgery. And we have our own aesthetic society. And so that is the two branches of basically the mainstay, the mainstream cosmetic facial surgery that's done in the United States. And so the facial plastic surgeons are the ones, I believe, that have started to describe this specific technique as a deep plane facelift. But it is using the SMAS. So you hear them say that the SMAS, them being people who use the deep plane, say that the SMAS lift is inferior, but what they're using is the SMAS. So all SMAS lifts are not one lift. So it's how you manipulate the SMAS that's important.
Yeah, because it sounds like all facelifts are SMAS. It's just how you, yeah,
how you use
do
it.
it.
Correct. And that is why it's so confusing, because there is a deep plane, but there is no one SMAS.
Okay. Okay. Are there others that are,
there's people
others
that
that are coming
use
up that's even better?
there's all kinds of things that have been, the deep plane's not new. It was back when my mentor was innovating, there was already a deep plane. These are all, everything is always built on principles from before. So there were endoscopic subperiosteals on the bone facelifts. I mean, there were all kinds of different things. But the bottom line principle is that you need to ask your surgeon how they're going to get your tissues back where they started, because you have to manipulate things so that you're lifting, releasing adequately to allow the movement that you need to bring the tissues back up to where they started. And there's many different ways to do that.
So the women that you're working with now who are in this perimenopause to menopause phase, let's say they're in their 50s, 60s, and they come to you like, I need a rehaul. I don't know, everything is drooping or falling apart. So I imagine you doing each individual case by case. Some women need to have their eyes lifted, some need a fat transfer, others don't. Or are you seeing across the board, okay, if you're in this age category, I'm going to probably do these three things on all of you and then tweak here and there with something else? What does that look like?
If I had my way with most people, because no one ages only in one area, right? Yeah. You're always going to get a more uniform, a more complete, a quote unquote prettier result, more glamorous maybe, if you do everything. Because by the time you're in your 50s, everything's fallen a little bit. Some areas more than others, but you're always going to get a better result if you're looking at a beauty ideal, if you do everything. But that's not for everyone. So sometimes women come in and they really need everything operated on, and they really are only interested in taking the upper eyelid skin off. And so you do have to work with the individual. But if I were to give my honest advice to everyone, pretty much everyone would benefit from a little nip and tuck everywhere, unfortunately. It's just the fact of aging.
So does somebody, okay, let's talk about the reality of things as the pocketbook. So imagine some women go, okay, well, one, I'm a little scared to get surgery. And two, maybe they don't know you so well, or it's the first time. And
That's
then
right.
I just want to do my eyes. Let's see how it goes. And then of
That's
course
right.
it's the budget thing. So what is that? I'm just trying to think of if that's an option, or I mean, it's an option, obviously, but maybe it's not the best in terms of doing everything at the same time. But then we do have to consider the budget and the fear and all that. How do you deal with that?
So that is what I do every single day, because I'm someone who's a believer in customization for someone, because it's not just about how you look, it's about how you approach this as well. Because there are many people who come in and they know they are interested in doing everything, but it's fear. Fear is probably the number one thing holding people back. Yeah. Finance is probably the second, and time is the third. But it's my goal to tell you what's possible and then work with you, your lifestyle, your budget, your emotions, and customize something, because everybody who comes in would like to get something. You don't call a doctor's office, you don't get in the car, pay the money to come in, park. I mean, I'm in the city, it's a big deal to get here, without really wanting something deep down or wanting to know about it in a serious way. And so it's my job to make it accessible to you, something that's comfortable for you, if I can, because I will never offer you something that's not going to help you. So whatever I offer you will be the least, if you're someone who's afraid, that will give you something. And so it's always a joy to me to have someone who's completely afraid, but we find something that they're comfortable with that's actually going to help them. So it would be great if everyone came in and said, yes, I want everything. And then I would have all these people that look great, right? But I have people that look really good, that are very happy. And I think that's ultimately the best thing, because I'm in the business of making people feel good. So it's whatever I can do to facilitate that process.
So what's the difference if somebody comes in and says, I want, okay, they have that fear and they have the budget and they
Mm-hmm.
go, let's start with my eyes. And then
Mm-hmm.
they think in their head, and then you tell me if this is a good idea or not. Okay, maybe next year I'll save a bit more
Mm-hmm.
money and then I'll
Mm-hmm.
do my jowls or
Mm-hmm.
whatever.
Mm-hmm.
And then I'll wait another year, or stretching it out
Yeah.
over this year.
Yeah.
Or is it
Mm-hmm.
better that you go, okay, they build the trust and maybe after 3 months they come back? Or are people
Right.
traumatized because their face is just in so much pain?
I'll tell you one really common trajectory. The upper lids, generally speaking, for most people, if you're an someone who can do some procedures, you can do under local in the office. So that is a very unintimidating way, relatively speaking, for people to start. And I get that a lot. So a lot of times people will come in and they'll say, I would like my eyes done. Well, in my office, I do the upper lids, if it's just the upper lids, under local. If you start to do the lower lids, in my hands, I think it's better if people have a little bit of anesthesia because it's just more comfortable. It's more precise, less blood, all of those things. And so for those people, I say, is this whole thing something you're going to want to do later? And if it is, sometimes I tell them just to start with the local procedure. And then you can cluster the lowers with all of the other stuff when you do one anesthetic. And so you can get it done in two different parts in a less intimidating way with less anesthesia. You just have to work with the person. But if I see that it makes more sense to organize things a different way, then I will offer that to people. And I think that, I mean, it's honest. It's working with something that logically makes sense.
Mhm.
And I think it makes people more comfortable. So
Mhm.
there are definitely different ways that you can separate things. Another common thing is just to do the top part, come back for the bottom part.
Does it work in terms of cost the same way as any other business? Is you do one part and then it's more expensive than if you say, let's just do all 4 or 5 things and it'll be
Mm-hmm.
cheaper. It will be only one anesthetic because you don't have to pay to get into the hospital or
Mm-hmm.
whatever it is that you need to do.
Yes.
So people maybe go, oh, okay, I'll just do it all at once and I'll save some money.
Yeah, people definitely do. I think more commonly, well, there's that, but I think a lot also is just the one recovery.
Yeah. And the
So
one,
the time and the recovery and just the hassle of it and the fear of it all, just to get it all done. So there is definitely those people in that mindset. You can definitely stage things. If you do each individual part, it's always going to cost more than if you do the whole thing together. You pay the operating room by time and the anesthesiologist by time for the most part. And so the longer the procedure is, the less time you're spending on each part. Whereas if you go in just for the brow, then you got to start, you do the brow, you got to stop. So it's going to cost more than if you just add it in when
yeah.
you're already started. So that makes sense.
Yeah, the recovery is a big deal. If I could have done both of my hips at the same time, I know it would have been a
See, yeah,
struggle, but
exactly. But it's harder. But it's harder.
it's harder to, yeah, it's
It is.
harder and it's, yeah, it's hard, but it's hard both ways. You kind of,
Mm-hmm.
when went through the first one already, you're like, God, I don't want to do this again. But you do what you do, whatever I guess is recommended by the doctor, and you do your homework. But since you're in the US, what
Mm-hmm.
are the prices like there for a deep, like a total rehaul, let's call the whole
Yeah.
facelift? And then
Mm-hmm.
how would that compare to somebody goes, I want to go to Mexico? Not that they should, but, or I don't know, Slovenia or some, I don't know, where
Mm-hmm.
there's good medical doctors and you could get it for cheaper. What are the costs?
If you just look at costs as a factor, then you're always going to get a better deal in most countries around the world, except the United States. The healthcare here is universally more expensive, I think, than most places. The standard of living is higher, so everything costs more. The wages are higher, so it all is in line. And then regionally, also in the United States, things are higher. And then the reputation of the surgeon and how much hype there is can also inflate the prices. So on average, I would say in the Bay Area, for a good experienced surgeon, you're looking at between 30 and 50,000 for a facial surgery, probably. But it can go as high as sky's the limit. I
Yeah.
would not be surprised if someone's charging 500,000. I don't know, but it's possible
Do we
because there
know
is
Kris
no.
Jenner's cost? Did anybody come up with the video of how much that cost?
I think that Kris Jenner's facelift probably would cost more now after all of the
Yes.
publicity than it did back then. So I don't know.
Yeah.
But that's the subjective nature of it. But
Yeah.
as a whole, I don't know the prices in Mexico, but my guess is it would be about a third. That's my guess.
Yeah. Okay. Yeah.
Yeah.
The whole world is so different. And I don't
Yes.
know. Yeah. I mean,
Yeah.
US is a center of medical excellency. We know that. But I guess
Exactly.
there's probably places in Europe. I just don't know the whole idea. But I, I think I want to wrap up with this. It reminds me of this woman. So when I had a hernia and I went
Hmm.
to see my doctor, and he is a plastic surgeon. And he was
Hmm.
telling me about this woman who was his next patient after me. And he said, oh, this one had two or three other doctors, like through two or three facelifts already with other
Hmm.
doctors. And so now he
Hmm.
came to her and to him, sorry, for another
Hmm.
one. I'm like, oh my goodness, do you see that a lot where people are getting quote unquote bad, or they're not
Yeah.
they're or is it also maybe they're just trying to chase something that doesn't exist, and maybe it's something deeper than just aesthetics?
I don't really see people that have dysmorphia per se because they tend to get very distorted. So they usually don't seek me out because my results are a little bit more natural, I think, than they're looking for. And then I also can't find anything that they need because they are so maximalized. But I do have people that just in general are, I call them maximalists. They like to upkeep. There's a lot of upkeep, and that's just their whole life. Everything about them is that way. And so I have women sometimes that will tweak their eyes 1 year, then 3 years later they'll tweak this, then they'll come back and do maybe just the mid face or just the neck, maybe another 3 years, 4 years, something like that. So they like to have things continually updated. Now, I will cut them off if it's not something that I think is going to benefit them. So yes, there are people that will do constant maintenance, but it can also be a healthy thing. It's not necessarily a negative thing. Depends on the person.
So what are the risks of getting a facelift, and where
Mhm.
can things go wrong?
The main things that we worry about as surgeons on the face specifically would be nerve injuries. So not so much sensory nerves, but motor nerves. So those are important nerves, and generally speaking, they're hard to reconstruct once it happens. Luckily, it's very rare, and luckily, most nerves are not cut; they're just injured and they come back. That's the vast majority of them. And then the other thing we worry about is skin circulation, so healing ability. And so you do want to make sure that you're not smoking, that any medical things that you have are well controlled. You want to set yourself up for success health wise.
Oh, wow. That's like a whole other podcast. I love surgery recoveries. That's something I always talk about. We should do an episode on how to have the best outcome once you've decided to do this. So
Yes.
if someone is considering surgery, then how should she shop for her surgeon?
Well, you know what? Your gut instinct goes a long way. There are surgeons that maybe every single person that you know went to X person, but you come into the office and you just don't click with X person.
Mhm.
That person may not be for you. So there's a surgeon for everybody. And it's just like a partner for everybody. So not every surgeon is for everybody. And I think that gut instinct is huge. I think also you have to do your homework. You have to check credentials. You have to have referrals. You have to look at pictures. So you do need to see examples of what it is you're looking at, because the bottom line is that surgeon may say they look natural, but if they do a natural result, but if everything you see doesn't look natural, then you're not going to get that, because that's not what they do. So you have to match your aesthetic to that person, and you have to match your personality to that person, and you have to feel comfortable that you're being heard, or whatever your criteria are. So I think you just trust your instincts and do some homework, and you'll be just fine, because there's most surgeons are really good. So
I think surgeons are their part of their business card is Instagram, because they can show
yes.
the befores and the afters, I think, in the
Mm-hmm.
most convincing. And so people
That's right.
may choose their surgeon or their dream surgeon. Sometimes they're
Mm-hmm.
untouchable, but they think, oh, wow, this is really good work. But
Mm-hmm.
also imagine on social media, the surgeons are only putting their best work. Like they don't put work that maybe didn't go
Yeah.
as planned, which
Right.
I guess can happen.
Right. Mm-hmm.
So
And
that,
so that is something that I always say to myself when I choose anything, is that anybody can have a really good result one time, but very few people can have a really good result every time. When I trained, I had the privilege of being with someone who had a good result almost every single time. And we probably did 100 facelifts, and there were maybe only 2 or 3 revisions. So that is that consistency. And that consistency comes with repetition and volume and dedication to the work. So, in other words, they're not doing 7 just to get it out the door. It's the care and the precision and just the repetitive nature of the art and the technique. So, you
Mm.
do want to look also at what does the surgeon actually do on a regular basis.
Yeah. There's so much to check off the box, the check boxes
Mm-hmm.
to check off because it's a
Yeah,
big deal. Like someone's cutting your
it's a
face.
big
Like,
deal. It's
yeah.
a big deal.
And you must
To
have a lot
this
of
day,
pressure
to
too.
this day, it makes me a little bit taken aback when someone says, "Well, I trust you," because those 3 words are so powerful.
Yeah.
Because I do this day in, day out. I've done this for over 20 years. That's nothing. I don't get nervous at all. But when someone says that to me, I remember, oh my God, this is a big deal,
Yeah.
right? And it's humbling.
It
So,
is. It is. When you go into that surgery, the same thing. I just, you have
mhm.
to tell the surgeon, I trust you. You have my life in your hands. And you
Well,
forget that as a
even more important,
surgeon.
you have your face in my hands.
Yes. And you're, yeah, and that if you do a mistake, then that's
Hmm.
life changing. So for
Yes,
the
it
good or
is.
the bad. So
It
people
is.
do have to trust you. I
Hmm.
actually just interviewed it just released a few days ago, Kris Jenner's hip surgeon, speaking of Kris Jenner,
Oh,
Dr. Jason Snibbe. And
okay.
yeah, and the episode was all about robotics and
Mm,
how robotics has changed surgery for joint surgeries.
hmm.
And it's not like a robot's cutting into you. It's just precision, at least for now. It's
Hmm.
helping the surgeon be so accurate where they're placing a hip or fixing the knee. So
Yes.
are there any robotics or AI that's being used in
There
surgery?
will be probably. There are increasingly more programs to simulate. I've never been one that's a big fan of that, particularly for soft tissue, because I don't think it's so accurate. But I do think that with AI, we might be able to get closer to giving you a really good idea of what you look like choosing X. And that would be fabulous. That would be amazing. So I'm hopeful that something better than what we have today will come about with this new tech boom, the AI boom.
I would imagine if one of the complications that can arise is the by accident cut a nerve, maybe it'll grow
Mhm.
back. And what if it doesn't? That maybe the technology would help avoid that. Maybe get so precise that it knows exactly where that nerve is and it could guide the surgeon.
Theoretically, if you could program a robot to do surgery, that might be possible. Who knows? I mean, we might all be just doing video games for jobs. I don't know. It's interesting.
Amazing. Well, I'm going to have to let you go. I've done way over time, but this was so juicy. I'm so excited
Oh,
to
good.
share this one. And if people want to reach out to you, I have your website, drcarolynchang.com, and your Instagram, your YouTube, your Facebook, your TikTok. You're kind of all over the place. Is there anything else that you'd like to cover or share before we let you go?
No, I think it's just an honor to be on this, and I love talking to you. So I think that's enough promotion.
Oh, good. Okay. Well, when I'm in San Francisco next, I'm going to come and see you.
Please do.
Dip my toes into your
Please do.
office and dream.
Absolutely.
All right. Thank you so much. And thank you, everyone who's reached to the end of the podcast. You're obviously just as interested as I am in this topic. And if you do reach out to Dr. Carolyn, say hi from me. And thank you, Dr. Carolyn. Have a wonderful day.